I'm Alyson Zulfer. I'm a pediatrician here at Weatherford Pediatrics and Family Medicine. I went to Texas A&M University for my undergrad. I ended up moving to Fort Worth for medical school and moved to Oklahoma, actually in Tulsa, for my pediatric residency. I always knew I wanted to be a pediatrician from the time I was probably in kindergarten. For me specifically, pediatrics was hands down always the way I wanted to go. Kids are much more fun. They are, I've always said everyone wants their kids to be well. I really appreciate kind of the relationship I form with moms. Being a mom myself has been very important in kind of my practice of medicine. As I've learned pediatrics, I've got to see it firsthand at home too, and kind of seen a different aspect of medicine, like the both parenting and the medical side of things. So it's been really great learning, kind of on-the-job learning. The last 4 years, I've been primarily an outpatient pediatrician. I also have covered the newborn nursery for a hospital. That is how I met Robert. We shared newborn nursery call and got to know each other. I felt like when we met, we both had very similar mindsets as far as practicing evidence-based medicine, really being up to date on everything, and being positive about it. And so our personalities, I think, clicked very well. And he was kind of on this journey already to look for a place to open a practice. And, we had this idea of kind of the whole family care being under one roof. And it just seemed like a really great fit. So I'm looking forward to getting to practice medicine in a more direct way. I am very passionate about building relationships with families. I really think that there's a level of trust that you have to have with your pediatrician as you walk through kind of the day-to-day of raising kids. So I really focus on relationships with families and building that trust, meeting moms where they are, and really having conversations and building that trust so that we can raise these kids together. Because I am also a mom and I am also walking through the struggle every day. So being able to kind of have that one-on-one time in the office and talk through any concerns or worries and be able to give some guidance, I think that's really important. And it's especially important in the pediatrician and mom relationships. What I'm looking forward to most about private practice is being more directly involved with decisions that we make for the patients. When you're part of a larger system, sometimes the focus can shift a bit. So I'm looking forward to being able to really tailor each patient's care to what their needs are specifically.